9:32 now. There are a few health issues more common and more embarrassing than bad breath. Usually the problem is just temporary, but what can you do for that uncomfortable odor when it won't go away? Fox Medical Team's Beth Galvin is here now with some advice from an Atlanta dentist. Good morning.
And good morning, Elise. I think we've all been there.
Yeah.
And the good news is that if you have bad breath, you have some options. But first you have to figure out where that odor is coming from. And that's where your dentist can really help.
Bad breath is a problem Inman Park Dentistry's Dr. Alex Rodriguez sees every day, and he's got some theories about it.
In general, bad breath is coming from bacteria in your mouth somewhere.
And Rodriguez says that somewhere is usually our tongue.
One of the first recommendations we have to people that are doing all the normal brushing and flossing is to include cleaning your tongue. They make products called tongue scrapers you can use to wipe your tongue. The tongue is like a big carpet, and there's space down in between the tufts of the carpet, and the bacteria live in there. And if you're cleaning those off, that'll help.
Germs can also accumulate between our teeth and along our gum line. So keeping our mouth clean, Rodriguez says, is critical.
Brushing and flossing. A lot of people underestimate how much surface area it really is around every single tooth.
A mouthwash can also help, but some will just mask bad breath.
If it's got a drug facts label that says anti-cavity or anti-gingivitis or one of those sorts of things, that's going to be more effective. Things like Listerine are fantastic at getting rid of bacteria, killing off bad bacteria.
And Rodriguez recommends patients try sugar-free gum.
Popping a piece in, chewing it for 15-20 minutes after meals, gets saliva flowing, gets little bits of food off the teeth. It's one of the best ways to clean things, short of brushing and flossing.
Breath spray can also temporarily mask bad breath, but Rodriguez says your best bet is to talk to your dentist.
We want it better just as much as you do, and because we know it's not just a smell issue. Usually there's a health issue behind it, and we want your mouth to be healthy.
And here's one thing you may not have known. Sometimes the culprit is tonsil stones, and that's when food and debris and bacteria accumulate on your tonsils in the back of your throat, and that can cause that bad odor. Your dentist can spot that problem usually, but Dr. Rodriguez says then you're going to need to see your doctor to talk about what to do about those tonsils and whether your tonsils need to be removed.
Yeah, get those taken out. Okay, colds and sinus infections, so common. A lot of people have those right now, so can that be contributing to this?
It absolutely can be causing bad breath. So that's something to know about. You know, if you've not been feeling well, if you've been fighting off a sinus infection and you're noticing a change in your breath, it can be that.
Okay, and Beth, what did he say about that rotten egg smell? What did he have to say?
So that's usually sulfur that's coming from the bacteria that's on, you know, the biofilm on your teeth. And so, and one funny thing I noticed is that you can't, you know how we always do that cupping smell where you put your hand in front of your mouth to see if your breath smells bad? Unfortunately, that doesn't really give you a good conclusive read on it, because it's when you're talking that your breath, you know, tends to smell, not when it's right up against your face.
Interesting. So bottom line, talk to your dentist about it.
Absolutely, because they can help.
For sure. Some good advice, Beth. Thank you for that.
Elise.
We appreciate it.